Welcome to The Big Unlock, where we discuss data, analytics, and emerging technologies in healthcare. Here's some of the most innovative thinkers in healthcare information technology talk about the digital transformation of healthcare and how they are driving change in their organizations.
Hello, everyone. This is Paddy. It's my real pleasure to have on this podcast my very special guest, Neal Singh, CEO of Caradigm. Neal, welcome.
Thank you, Paddy. I appreciate the honor to attend your podcast and happy to answer any questions today.
Wonderful, wonderful. Let's start with this. For the benefit of our listeners, tell us a bit about Caradigm and what problem Caradigm solves for healthcare today.
Sure. So Caradigm, Paddy, was set up in 2012 as a joint venture between Microsoft and GE. And from day one, we have been set up as a population health software company, and that continues to be our strategy and focus. Our key differentiator is that we provide a tightly end-to-end, highly integrated enterprise population health portfolio of applications, both with handling data, analytics, as well as care coordination. Specifically in the context of data, we offer real-time data analytics and in terms of getting data in from multiple systems in a real-time basis and taking action on it versus just doing traditional ETL mechanisms to get data once a month or once a quarter. And the other differentiator that we have is we actually get data across multiple spectrums of healthcare. So be it clinical, claims, financial, and now we have even extended deeper into social determinants of health. And what we have found historically is many vendors just focus on just clinical or just claims. And I think having the superset really allows our customers to get a significant leg up in terms of being able to help our patients move towards the population health goals. Specifically in the context of social determinants of health, we recognize the importance and value in the context of social, economic, and environmental factors, which determine about 50% of the overall health of the patient. And at least 25 cents of every healthcare dollar is being now spent in treatment of conditions resulting from potentially changeable behaviors. An example, for example, zip code is a strong predictor on a person's health than even their genetic code in some cases.
Right.
And the National Quality Forum, CDC, and WHO all acknowledge the importance of social determinants of health.
Right. I'm going to come back to the different data types and the emerging data types in a minute. But you define Caradigm as a population health management company. How has the definition of population health management changed over the last couple of years, or has it changed at all?
Yeah, absolutely. I think in fact, I would say it's not changed, but it's solidified is probably the word to use. What we have seen specifically is that we work very closely in conjunction with Class Research, and Class Research has defined a definition of population health management, which is the process of proactively monitoring and caring for defined patient groups. I think furthermore, drawing on healthcare organizations and their leading pop health vendors, we have participated with them as well, and that's they have assembled a framework. And this framework really has 7 core aspects of capabilities, which is aggregation, analysis, care coordination and health improvement, administrative and financial, patient engagement, and clinician engagement. So these are the core 7 areas they have defined on a framework.
Right.
I think we have even tried to simplify it down to kind of, I would say, 3 core capabilities, which is if you want to do effective population management, you really got to focus on data control, on the healthcare analytics, and care coordination and engagement to deliver solutions in these category of applications in the population health space.
Right. So it sounds like population health management, as you define it or as you stated it, the definition has solidified. So people have a better understanding, and there is some common framework that people are applying to define population health management. And so there's a common language in the marketplace that is emerging, which was not the case a couple of years ago. People meant, they meant different things when they said population health management. So, obviously the data sources, you referred to some of them, and it's key to population health management to develop a holistic view of patients. And you rightly mentioned social determinants of health, zip code, as an example, as one of the strongest predictors of health and wellness among populations. So, the data sources are emerging. They are kind of in structured and unstructured formats, and they look a lot different from your standard structured electronic health records. You're talking about social determinants, you're talking about IoT data, you're talking about genomics data, all kinds of data sources. What do you see are the biggest challenges the industry is going to have to overcome in being able to harness all of this data to generate the kind of insights you need to effectively be a population health management company, or effectively manage population health if you're a health system?
I think that's an excellent question. I think there are a few pieces. Number one is you need to have systems, infrastructure, and capability to be able to aggregate, the growing set of data pieces, right? Whether it is, like I mentioned earlier, there's the clinical claims, financial, expanding to social determinants of health. You mentioned genomics and IoT. I think we will continue to see data sources increase at even a much faster accelerating pace. So you need a system that can scale and take in different data types. And that, I think, is one key aspect of what you need in any platform to be able to move forward and provide population health management. The second piece is as these different data sources keep coming in, how do you start not just aggregating the data, but how do you pull that data in and make that available throughout your entire application set so that you can start reaping the benefits in a very seamless manner. So I think those two pieces are combined at the meta level, important aspects of how do you basically deal with data. Then getting to the next part of the question, which is, how do we think about these different sources of data? For example, you mentioned genomics. I think genomics is early on. It's a key part of precision health in terms of where precision health will end up with, and I see basically more of population health, morphing into basically aspects of precision health over a longer period of time. But I think right now genomics is commercially not viable. It's basically still a very expensive tool, and I think as the prices come down, as the applicability becomes more widely usable, I think it'll become a key part of data, just as what we're talking about today in the case of social determinants of health. Beyond the few data points I mentioned earlier on social determinants of health, what we're doing is, we have taken a much more broader approach to social determinants. For example, like many application providers, what they do is they ask a few questions and they display the answers as social determinants of health. I think that's very much at the periphery level. It's a good marketing message, but it doesn't really add any value. So what we're doing is really upping the game in terms of taking these large data sets and pulling them into our system, normalizing them, and then morphing them in terms of different application scenarios. So for example, when we do stratification of risk, meaning we're trying to figure out of these, millions of patients, which ones the provider should focus on, we basically, we build our algorithms, which are driven with AI now as a mix, to really drive towards, patients who have a higher socioeconomic risk profile. We use social determinants of health to help drive a risk stratification, before we start making actions in terms of the clinical side of the equation. In care management, we are trying to understand the socioeconomic profile of a patient before engaging with them. We are tailoring the goals and intervention for their care of plans based on data that drives through the social determinants of health. In quality improvement, we're identifying potential barriers to closing gaps. Example, transportation gaps. Somebody doesn't have transportation access. How will they be able to close a gap in care? And of course, the Knowledge Hub basically providing insight to providers about their patient through the gathering of this data. So I think there are many aspects, even some other aspects that come into play, like identifying communities who need a particular resource for, or basically a community health worker who wants to provide home visits to care managers, and location and dialysis facilities as to where their availability is. So there are lots of things that we can do with social data, but the main point is how do we make that available seamlessly in the applications as part of their workflow versus the care manager or care coordinator having to figure out, hey, here's some social data, let me try to figure out how to integrate that into my day-to-day life.
Right. Well, when we talk about all these new and emerging data sources, we have to talk about two things. One is the I word, interoperability, right? How are we going to solve that? So that's one. And then the other thing, you already touched upon this whole notion of, marketing message versus real substance to what you're doing. And in that context, AI, everybody is talking AI. I know these are slightly unrelated, but I would like you to, touch upon this. Are we going to see an interoperability solution? Is FHIR going to be the solution? What is the solution, and how are you approaching it? And then tell me a little bit about what you think of AI. Is it hype? Is it real? What are you guys doing?
No, sure. I think that's an excellent question, especially given the conversations happening today in the market around both these topics. So I think from a Caradigm perspective, we welcome advances in improving interoperability amongst different systems. We know that certain EMR vendors have been hesitant in sharing data, and new protocols like FHIR help break down those barriers. I think that should lead towards more comprehensive patient records, improve communication, and ultimately improve patient outcomes. Now, while FHIR can provide benefit, it's better utilized towards what I would quantify as low to medium volume transactions. And when it comes to high volume bulk transfers of megabytes of data, which we do very regularly for large population of our providers, I think you still have to resort today to the traditional web services and ETL mechanisms to drive larger volume. And I think the other portion is, I love the fact that Apple has now made FHIR an interface for individual patient records, and I think that's a perfect example of how companies like Apple are going to help drive the ecosystem forward on interoperability. And that portion, of course, still focuses on an individual patient getting access to the record from a set of providers who basically agree to partner with Apple. I hope that ecosystem continues to grow, because I think it's super important for healthcare transparency and even wellness that patients have access to all their records seamlessly. And I think that would be a great outcome for patients.
Mm-hmm.
Now,
tell me about AI.
Getting into the AI piece, it's a very good question in terms of is it hype or reality. I think AI is one of the next key advances in healthcare. I think a solution that incorporates machine learning, deep learning, can provide better analytics to an organization. Well, I think it's moving from what I would say being hype to now showing early promise of delivery. What we are doing specifically, before I kind of deep dive into that piece, is what we're doing specifically. We have taken an approach to AI which is different than a lot of the healthcare startups that are trying to formulate algorithms around AI or even make statements around AI. I think many AI vendors position themselves as the AI company, or the product that you have to buy, or the thing that you have to buy and then figure out how to work with your IT organization to enable within your workflow. I think we are taking an approach that AI needs to be seamlessly infused throughout our system. It needs to be ambiently embedded across our application workflows, and customers should not have to do anything special to buy or enable AI in order to reap the benefits, or even know the existence of AI for that matter. I think
make it invisible, in other words.
Absolutely. I mean, and that's where, and really we need to focus on not AI as a technology, but in terms of what outcomes and ROI we can reap for our customers. I think that's really where we are focusing in terms of our investments and in terms of our outcomes.
That is so well said, Neal. That is so well said, because I think a few years back we had the same thing with big data, right? As though big data was the solution, or was the be all and end all. But we've seen that over time, it just permeates through an entire analytics infrastructure, and it's no longer visible. It's invisible to the point of it seamlessly being incorporated into all advanced technology solutions, right? Would that be a fair statement?
Yeah, I would agree. I think you said it, articulated it extremely well. That's exactly what we would love to see.
Right.
And so what we're doing is, we have been investing. We have got a partnership with Microsoft. We're in fact doing a pretty big launch around, intelligent population health, as we call it. How do we bring AI into population health? So there'll be a pretty big launch happening next week at HIMSS around what we're doing in AI, and specifically in terms of what scenarios we are enabling within the workflow. So whether it's bringing intelligence into how we stratify the population of patients, or bringing intelligence into how care coordination, assessment workflows become smarter and better. So we have basically enabled AI in our system. We don't plan to charge customers for AI. We plan to basically deliver differentiating value proposition where AIs make our systems significantly smarter for our customers and drive significant value for them in these workflows. And to be honest, we are early on. I think the industry is early on, but more importantly, what we're doing is we've become very thoughtful about working with real customers and real data to identify real outcomes. I think that's important because sitting in a computer lab building AI is an interesting technology experiment. But what we are doing is we are working with real customers and then enabling these as part of the workflow so that the next customer basically gets the benefit of that enablement without either having to pay for it or even knowing that it exists in the system.
Awesome. I just love that whole position that you stated. I think that is so important for your customers and also your competitors and peers in the industry to understand. Because ultimately, it is about what it does. It's not a be-all and end-all in itself. That's wonderful. You were one of the contributors to my recent book, The Big Unlock. And once again, I must thank you for taking the time for speaking with me and providing me with the inputs. So there's one thing that you had said there that stuck with me. You had said that health systems are going to find it increasingly hard to live by the rule that they will operate within a single EHR system. For the benefit of our listeners and for my own benefit, I'd like to hear you say it again. What should health systems be doing? Those who are locked into a single EHR. What's the way forward for them?
That's a good question. So the concept and notion of a single EHR, I think there are certain hospital systems that are locked into a single EHR. But as even single EHR hospitals, are now rethinking that strategy because as a lot of M&A activity is happening, it's nearly impossible to keep buying hospital systems and then trying to spend a large chunk of IT dollars in just bringing people into a single EHR system. But I think what's made it even more, I would say, harder to think about everything sitting in one EHR is this notion around accountable care or around clinically integrated networks. And so, if you're taking on an accountable care contract, especially as part of that accountable care contract, whether it's a commercial or a federal contract, you may have to provide care with other organizations, and they basically may not be in the same EMR system, and they may not even be of your size in terms of if you're a large enterprise player partnering with another enterprise player or partnering with smaller clinics. Right? You can't have the same EMR everywhere, or even try to say that, look, we can't provide care until all the systems get on one EMR, which can take many, many years. So really, I think in that world, if you want to be successful in this new payment reform model of value-based care, I think you have to really think about how can you operate in an environment with multiple systems, whether they are EMR, whether they are claim systems, whether they are financial systems, whether they are social data systems. I think you really have to live within this world. So you really need a system that can actually help you cross the boundaries of data, but also more importantly, cross the boundaries of your enterprise organization and be able to scale to that level of getting data seamlessly. So that really what you can do is say, I can provide care. I'll give you an example. Let's say, I'm providing care for a patient and I'm a care manager. And, one of the things I'm trying to basically do is make sure that I can provide the maximum amount of high quality care for the patient outside the hospital so they can do the right things from a wellness and care and prescription perspective to take care of their care. But then my patient basically shows up in an ER system for some medical situation. If that ER system sits outside my EHR, then basically I would never know that happened. But if you're in this cross-enterprise data scenario, in our systems, what we do is we alert the care manager, hey, your patient showed up in this ER today, and no matter what EMR system was there. And then what happens is they can follow up with that patient later on during the day to find out what happened, why did they have to go to ER. Again, this is how you can prevent a lot of unnecessary ER consumption, and which is very expensive, right? So that's an example of how you really have to think across one EMR and across one data source.
Very interesting, very interesting. So, you mentioned value-based care, right? So we know the industry is shifting towards value-based care, but maybe it's not happening as quickly or as rapidly as we would like it. Still a lot of fee-for-service arrangements out there. But can you talk a little bit about what you see in the current policy environment, and especially as it relates to the shift towards value-based care? What does it mean? What are the implications for your business, and where do you see it headed?
That's an excellent question. I think, despite the uncertainty at the federal level, I think the shift to value-based care has not stopped. I mean, it's continuing to move in that direction because ultimately the move towards value-based care is really around basics and principles of economics, right? You have to really you can't continue in a world where you basically are not focused on outcome-driven payment systems and continue to increase healthcare costs along the way. I think people are moving past the uncertainty and even with the changes, we're seeing two major shifts. One is more emphasis from the private sector side, health plans and employers in particular. And secondly, we are seeing an increase in breadth and diversity of value-based care programs. For example, MAAP, bundle payments, and the likes of that. So I think that portion will continue to become more and more prevalent. But then also, I think at the federal side, we are seeing more movement from voluntary, from mandatory to voluntary programs. So I think there will continue to be growth. But I think especially in 2018, we have seen the shift, while 2017, especially the second half, seemed to have stalled. We're seeing a significant acceleration happening now in 2018. And that's purely based on what we are seeing from a commercial pipeline and a sell-through perspective. The other portion, I think, is I think organizations sees an opportunity to become competitive in a market where their competitors may not be moving as fast. So while we'll see lawmakers continue to battle it out, I think we face one fact that value-based care is here to stay. Providers who basically push forward with what we call as a no regrets strategy, which means prioritizing efforts to drive more consistent, efficient, and coordinated care, integrating the IT systems to support accurately forecasting patient risk, lowering cost structures, and building deeper relationships and loyalty with their patients. And I think that no regret strategy will help you no matter whether you're in fee-for-service or value-based care.
No regret strategy. I like that term. Okay, last question for you. What are your 2018 priorities for Caradigm?
Yeah, I mean, we are focusing on several things. I think the main thing that we are trying to do is we're trying to focus heavily on what I would say is rapid time to value. And what we mean by rapid time to value is how can our customers get time to value very quickly from our system. So when we deploy systems, how quickly can we have our systems go live? But live is just a milestone. How quickly can our systems be adopted is more important. And then more importantly, what is the outcome and ROI our customers are achieving? So we focus now very heavily on that time to value equation. So it used to be TCO in the old world of total cost of ownership. At a company level, across the board, every single employee in the company is focused around customer outcomes and driving time as a key factor in terms of getting those outcomes for them in a very rapid way. And then the second piece in that same notion of time to value is, we have traditionally focused on enterprise customers with fully integrated systems that have a single platform, and we're able to service application on a single platform to drive time to value for our enterprise customers. We have now, launched out solutions that are very quickly adoptable with prepackaged solutions that, mid to small ACOs can adopt and get rapid time to value. Literally, we're talking about, go lives that can happen within 30 days of signing a contract. And that I think is very significant and very fast, which is kind of unheard of in the healthcare industry in terms of how we can drive fast value for our customers. The third piece really is around, I think we have to continue to focus on innovation, but the way we are thinking about innovation is very rapid. So, we have a deep technology partnership with Microsoft, primarily because of, our roots back to the joint venture with Microsoft, where half the company came out of, but also in terms of really, taking advantage of the deep talent that Microsoft has. So, for example, Microsoft has made some very significant investments around visual analytics. So we're going to launch what I call as Power BI for healthcare, which is basically how can healthcare organizations get fast time to value around self-service analytics without having to know the understanding about how to do plumbing and hosting and taking care of security and HIPAA compliance in a very seamless manner. So I think that's where we've kind of put together with Microsoft's help in building out the Caradigm Visual Analytics solution. AI is a good example where we're using Microsoft technology, again, not a standalone as the thing that you buy versus as a seamlessly integrated capability throughout entire workflow. And then, the social determinants of health, I think we are doing some really cool and interesting stuff. And in all these areas, while we have done a lot of technology platforms, when we're enabling use cases that we're launching at HIMSS, many of them with customers, I think over the next 12 months, you will see us creating a very significant volume, especially in these three areas for having customer value-oriented solutions delivered to the market.
Awesome. So in one short sentence, would you say the mantra for this year is customer success?
Absolutely. You nailed it.
All right. Fantastic. Neal, it's been a real pleasure speaking with you, as always, and thank you for your time. And have a wonderful HIMSS. Look forward to seeing you there.
Thank you, Paddy. You have a good one, too. I look forward to seeing you there as well.
We hope you enjoyed this podcast. Subscribe to our podcast series at www.thebigunlock.com and write to us at info@thebigunlock.com.